Dr. Cooray, we are living with COVID-19 for nearly 2 years now. But in your opinion, what is the role of the government when tackling a crisis like this?
Well, I suppose, yeah, in anything, especially in any public health problem like this, the main responsibility lies with the government. The government has to take the lead role, and it has to, lead the way. Actually, we now see the governments who have done so in the past with regard to the COVID epidemic. Those countries have flourished, and the governments which have failed in this endeavor, those countries have failed miserably. And I think now it's quite clear, we have fallen to the second category, and likely that, we have failed miserably, and there are whole heap of problems that have come about, not only health wise, but also with regard to the social life and the economic life, and so on and so forth. A lot of problems now we encounter day to day, and this had taken us to a very, very precarious situation, so to speak. Yeah.
Right, doctor. So when we talk about tackling this by the government, one of the institutions that we can talk about is the National Operations Center for Prevention of COVID-19 outbreak. Right now, it's handled by the Army commander. Do you think an Army commander is a competent person to handle a crisis like this?
Well, I'm sorry to say, I don't think so. I think, uh, looking back, perhaps one can think uh, that could have been, one of the main failures, or one of the reasons for the present state of affairs that we face with regard to the epidemic. Because what I think is, this is essentially a public health issue. There are a lot of social aspects related to this, closely impinging on this issue. And I think, therefore, this has to be handled by somebody who is versed on this, as well as who is technically competent in doing so, or basically who is assigned to doing so. And I think now, in the very outset itself, this is a mistake that we did, and it seems to be that we likely had a kind of a military. We were trying to have a military approach to this problem, and I think, looking back now, we can see that, the things have not happened as we expected. And again, on the same lines, now, in fact, now we can think that, if but there could have been certain areas the military should have, or we would have given responsibility to the military over the other areas. Now, for example, now we see in Australia, the military has given the prime responsibility with regard to vaccination. So that is, just one part of the response. So likewise, in areas where you think that the military has the capability to organize and implement, those areas, you can, you can invite the military and ask them to take a lead role. But whereas, having the military for overall, as the military as the overall leader in this, I don't think was a wise decision.
Right, doctor. So, whenever the COVID-19 crisis goes out of hand, the public is blamed for it. They're told that they've acted wrong responsibly, and that's why this went wrong. Do you think the public is the sole party that is responsible for such a incident where COVID-19 is going out of hand and is spreading among the community?
I think, this is a very, very wrong and very bad approach by the authorities. But I suppose, another important issue here is, you got to identify who the public is. The public is, you and I and everybody, all of us belong to this community. I mean, all of us is one big community. In a public health issue like this, what is of paramount importance is to harness the maximum support of the public. For that, it is very important that you have to have a very close rapport and a very you have to win the confidence of the public, and that has to be the attitude, and that has to be the strategy from the word go. And again, I think in this regard, what is very important is, I mean, we should not see this as a power relationship. The authority should not, identify themselves as the people with, a lot of authority and a lot of power, who can impose things on public. Now, this is one aspect that was, very, very evident and prevalent right throughout throughout our COVID response. And I think, basically this has backfired. And because the proper approach would have been to win the confidence of the public. And when I say winning the confidence of the public, the authorities have to show that, they are also as equal as the public and they are in the public side. But we see from utterances from various, various quarters. In fact, I mean, sorry to say, from the minister minister to down, I mean, we didn't see such an approach. Actually, what we saw was something, quite contrary to that. So we saw, time and again, top politicians coming on TV and blaming the public for the spread of the epidemic. But actually, I think, from the public side, the public did their utmost. Now, even today, we see that, they follow safety precautions, and sometimes, they would go an extra mile even. Now, something that I see, very commonly, I mean, they would, the point is, they're scared of the epidemic. And again, sometimes I would say they are scared than, what this epidemic really warrants. So now you see, I mean, it's a very common sight that people wearing 2 masks, and apart from that, they would also wear another face shield, and they would, carry their own sanitizers or whatever. So likewise, I see at least, certain segments of the community is very concerned about the spread of the disease, and invariably to protect themselves. So now this is the very essence of the community that should have been, captured and nurtured. But whereas this is something that we saw lacking in our response, uh, I would say, I mean, this is not only, limited to our COVID response, but also to to other public health responses as well. We have seen this time and again with regard to the dengue response, and in various other public health situations we have seen this. And it is a sorry state that, the same thing is happening over and over again. Yeah.
And Doctor, moving forward, how do you think, in your opinion, that we should really handle this crisis?
Well, I mean, uh, perhaps, uh, as of now, I'm just wondering whether this could be a difficult question to answer, because, I mean, to be, realistic, we see that the problem has has expanded to very serious levels. And I think as of now, we have something like 280,000 reported cases, and rather, uh, uh, the number of deaths, which I'm not, now following on daily basis, because this has become, it seems to be that, this has gone, some kind of, out of control. So anyhow, uh, so the coming back to the question that you asked, so I mean, we got to be very realistic, and I think, I mean, still the basic principles with regard to the control of epidemic still prevails. And the epidemic would have, gone through many phases, and it had now gone for more than 1.5 years or whatever. But still, the fundamentals remain the same, and they are valid, and they will continue to be valid forever. So I suppose the main fundamentals that we need to always focus on are, there are various, stages or various aspects to this. One is the individual, when it comes to the individual's responsibility. So here, with regard to the individuals, the most important thing is to uh, make things possible for him to be staying at home as much as possible. Now this is something that should have been, looked at very carefully by the authorities. Uh, Now, from at the very beginning of the epidemic, they would have, thought of, the amount of jobs that could have been, handled at home, and they should have been, given opportunity to do so, because not all the jobs are possible to be, handled this way, especially the jobs which involve production. But whereas the service sector jobs, a certain amount of service sector jobs would have been handled this way. But now when you go out to the street in the morning, I mean, anybody can see, the number of vehicles going about. So we see that, this is not happening as expected, and also we see the same thing with regard to the public transportation. The public transportation is again jam-packed, and uh, so we are not getting the results that we expected before. And the second thing is, with regard to the community, it is very important to maintain the basic public health measures, out of which I think the most important thing is you maintaining your 1 meter distance between yourselves, and again, frequent hand washings and things like that. And another thing is that actually I would say, that didn't, really come up in this the broader discourse. That is the responsibility of the professionals and the responsibility of the service sector. Now, here, something very commonly discussed today is what had happened in the education sector, and we see, how hampered the school children are. Their school education, their exams, everything have been, affected. And again, another very important thing, I'm somewhat, surprised that, why this doesn't come into discussion often. What had happened in the health sector, about regular health sector. For example, in the state health sector, uh, the what do you call these clinics for the non-communicable diseases like, diabetes and pressure and heart ailments, so on and so forth. These clinics are not being held for quite a long time, or, since the beginning of this epidemic. So these patients are not being seen in clinics. Only, their drugs are just written and, dispensed to them. And again, the routine surgeries in the hospital sector have been, just stopped. So the patients who are to undergo so-called routine surgeries are the surgeries which are not the emergency surgeries. Say somebody, meets with an accident and need to be, attended to immediately. So that's a emergency surgery. But whereas the surgeries like, hernia operations and even, heart surgeries, the bowel surgeries, and even, cancer surgeries, likewise, all these fall into the category of routine surgeries. So these surgeries are just, are stopped. They are not performed in the government sector hospitals. But you see, all these things happen in the private sector. So if you have money, you can go to the private hospital and channel the same doctor and get these operations done there. But now, just think of the situation of the poor, who are, who are just, who have nothing else to do but to suffer. So now these are other aspects, and also the school immunization programs. All these have, just come to a total standstill. So this is one aspect. That's the third aspect with regard to the responsibilities that, we have to make sure are continued. And also another very important responsibility lies with the media to ensure that, no form of discrimination is displayed against any segment of the society with regard to ethnicity or religion or whatever. And I suppose above all, the most important thing is with regard to the responsibility of the government. The responsibility of the government, lies above all that. And in nutshell, it could be said that, it overarches everything. And the crux of the matter is the government has to take the right decisions all the time. So the countries that have taken the right decisions all the time have succeeded, they are faring well. And the countries that have failed to do so have, failed in responding to this epidemic.